Hey, everybody. My name is Carissa Belk. I'm a registered nurse and certified diabetes educator at Lexington Endocrinology. And I do a lot of working there with glucose monitors. So Natalie asked me to speak a little bit about monitors and equipment because there's a lot of new things on the block. So she wanted me to talk a little bit about them and how they work and how to interpret some of the data you're getting. So we're going to talk about glucose monitors. So Natalie, if you'll go to the next one. And please let me know as I go if I'm telling you, if I'm boring you or you want to know something else. I'm cool with questions. So the first slide is depicting traditional glucose monitors. I think most people are kind of familiar with those where you prick your finger and put your blood on a strip and your meter reads it. And I think pretty much everybody's used one of these by now. And I promise you there's going to be some slides later in the presentation that do not show perfect blood sugars. People I've heard it, they're like, why do meters always show good blood sugars? But I promise you later, they won't all be perfect. So, okay, you can go to the next one. Now, kind of the new kid on the block that everybody talks about is continuous glucose monitors. Now, you'll hear me refer to them often as CGM. This is a device that will insert a tiny filament the size of fishing wire under your skin that will read your glucose in the fluid between your skin cells every 5 minutes. Now, please keep in mind, this is not a direct measure of your blood sugar, but because there's a relationship between the fluid between your skin cells and your blood, the FDA allows us to use these. Your body's nutrients are pulsed through your body and your blood vessels, and it's slowly absorbed into the surrounding tissue. So what's being read by your continuous glucose sensor is a little bit behind what's actually in your blood. So again, it's not a direct measure, it's indirect. Now, the continuous glucose monitor companies will tell you that, and they advertise that if you use these devices, you'll never have to prick your finger again. But that is not true. Again, because it's not a direct measure of your blood sugar, you still are going to have to continue on occasion to check your blood sugar and prick your finger. So, you know, unfortunately, diabetes is big business. People want you to spend all your money on their products. So with diabetes, just like with everything else, you kind of need to be an informed consumer. But just because you use these devices, do not think you'll never prick your finger again, because you will. Now, what you see on the screen, whoops. Now, what you see here are kind of the two continuous glucose monitors that we see the most. There's a couple of other ones, but these are the ones we see the most. The one on my left, the one that's on the abdomen, is showing you the Dexcom sensor and transmitter. And the one that you see on the right is the Librera system, and it's worn on the back of your arm. Okay, so what's best? So Natalie, you can switch now. So a lot of what is best comes down to affordability, because with most things we have to consider what we can afford. And these new glucose monitors can be pretty expensive. The traditional glucometer, where you prick your finger, they're well covered by insurances. Now, there's some insurances that prefer one over the other, but those are very well covered by insurance. Now, the continuous glucose monitors, some insurances cover them well, some insurances don't. And so I encourage you, if you're looking at continuous glucose monitors, to call your insurance and find out what they do and don't pay for, And if they pay for them, do they have conditions? For example, Medicare's condition to get a continuous glucose monitor is that you're on multiple daily insulin injections and you're checking blood sugars 4 times a day. Now, they've waived some of this with COVID, but I assume that in the near future, they're probably going to reinstate these conditions. But again, you know, multiple daily insulin injections and checking your blood sugar 4 times a day. And they're pretty much sticklers about that. And a lot of insurances follow those particular guidelines. So find out what your insurance pays for, you know, your budget. These continuous glucose monitors can be pricey, so you kind of have to make some decisions as to affordability and can you afford them or not. Yeah, they're cool, but is it something that you can realistically do? Both of these glucose monitors, as far as the Dexcom and the Libre, are very good. So a lot of it is just going to be personal considerations as to whether you want to wear something on your arm or your abdomen. And the Dexcom has a smartphone app, and the newer Libre does not have a smartphone app working with it yet because they've not gotten FDA approval because it's that new. So it may or may not be something that's for your preference. So now we've talked a little bit about continuous glucose monitors. So now let's talk about how to interpret the data. Now, whether you're using a traditional glucose monitor or a continuous glucose monitor, your glucose targets are the same. Before meals, the ADA blood sugar targets are 80 to 130 before a meal and 80 to 180 2 hours after a meal. Those will not change despite what instrument you're using. So you can go to the next one. This is showing a traditional glucometer. It's showing that the blood sugar is 104. That is a great reading. Before meals, after meals. This says that it's at 7:33 in the evening, so that's a good blood sugar. It's probably after dinner. That's good. So you can go to the next one. Now, this is a Libre, and what it's showing is the 112 is the blood sugar reading, and your continuous glucose monitors are always going to show you a number and a trend arrow. So 112 is your number. You get an arrow to the side. This arrow is going up at an angle. That means somebody's blood sugar is rising. So you've got a good blood sugar, 112. Your trend arrows that you're rising. You also see your 3-hour trend graph at the bottom. So overall, we're looking pretty good right now. So the way to interpret this kind of depends on where you are. This says it's at 10 o'clock in the evening. So probably at this point, you're after dinner. It looks like you're going up a little bit. Maybe you had a little snack or something before going to bed. But this is not a bad situation. But again, you have to remember that this is not a direct measure of your blood sugar. So if you have a low blood sugar, you always want to verify a low blood sugar with a finger prick. And if you're doing the treatment via American Diabetes Association standards, where if your blood sugar is less than 70, that's what we classify a low. And their recommended treatment is 15 grams of carbohydrate every 15 minutes until your blood sugar's up over 80. You want to make sure that you're checking that with a finger prick, because since the Libre is behind what's in your blood sugar, then that's going to be much slower to show your blood sugar coming back up. So you always want to treat lows with finger prick. It doesn't matter which continuous glucose monitor you're using, because again, the continuous glucose monitor doesn't pick up that your blood sugar's coming up for a while because it's on a delay. So, okay, we can go to the next one. Now, if you're using a Libre, if you see this symbol where the magnifying glass is with a blood droplet, you always want to do a finger prick, because the Libre is an electronic device. It recognizes when something in the system's not going well, so it will prompt you to do a finger prick when it knows something's not right. This is your prompt. When you see the magnifying glass and the blood droplet, that is your prompt to do finger prick. Okay, we can go to the next one. Okay, so this is a Dexcom, and note that it's kind of the same information, but it's looks a little different. So you've still got your number up top of 110, and the trend arrow is straight out, so that means the blood sugar is stable. And then at the bottom, you have your 3-hour trend graph. A couple of niceties about the Dexcom is if you use a smartphone app, they've got a follow me feature that allows family members to see what your blood sugar is. And there's a couple other things with the smartphone apps, but the big thing people like is that it allows their family to see what their blood sugar is. Okay, we can go to the next one. Now, here's where you see where the rubber meets the road. This is some things that I saw at the office just in this last week. I've taken names off, so it's not a HIPAA violation, but this is some things I saw just in the last week. So you'll know that you're not the only one with blood sugars that aren't where they need to be. So on the right hand, or excuse me, on the left hand side, we've got a Libre download that, and what I'm showing you here is what we call the traffic light or the stop light. And you've got green, which is good. We want a lot of green, and yellow and red. So the green is the good. Now this person's green is your target range. It's 42%. We want that to be 70 to 80%. American Diabetes Association says 70%. I've seen a couple of doctors in our office that they say they want it to be closer to 80%. But so this person is in target range 42% of the time, high 54% of the time. So we got some work to do on this person. Now, on my right, what I'm seeing is kind of a traditional glucose printout. Now, depending on the medication you're on, some people want 2 blood sugar checks a day. Most of the people that are in my office are on some degree of insulin, so they're on 4 checks a day. So this particular person, some days is not checking blood sugars at all. Some days checking blood sugar once, twice a day. This person's just real random. So I always wonder when I see things like that, if they're random checking their blood sugar, a lot of times they're random taking medicine. So I would want to know how they're taking their medicine, if they're taking it correctly. And the other thing I look at is on one day you see a low because it's below the line. Those lines in the gray is where, so over on the left, the target range is notated by the green. So in a traditional glucometer readout, the target range is notated in between the gray lines. So notice we've got one low and a day later, they're really high. So we want to cut those fluctuations out because if there's a lot of those, that's harmful to your body. because it's not all just about A1C. Some of it's about fluctuations. And if you're going back and forth from 40 to 400, that can cause a lot of damage to your body. So we definitely talk about the fluctuations. And most commonly, the fluctuations are like the low could have been from eating a light meal or skipping a meal. The high could have been from a large meal or missing medicine. So we would have just talked about those things. So, and Natalie, flip. So this is not your grandma's diabetes. We've got lots of cool tools and things to play with now that we didn't have even 5 years ago, because the glucose meters really have just really started being used in the CGMs in the last couple of years. So any questions from anybody? That's my presentation. So tell me what your questions are. Nobody has any questions?
If anyone has any questions, be sure to remove your unmute yourselves.
So this is Kathy. I have several questions.
Okay.
Sorry since I'm new to it, I have several questions. One, my first one, I've just been going to my regular doctor. When should I make the choice of going to a specialist like you?
So oftentimes if your diabetes is early and your A1C is good, your primary care is great at managing cases like that. When your case starts getting complicated and hard to manage and your A1C's up, and the American Diabetes Association recommends that your A1C stay around 7%. So if your A1C is 8 or 9% and it's been 6, 8 months, 9 months, and your A1C is not going down and you're not seeing any improvement, then that might be a time you want to seek us out.
Would I have to have a referral from my regular physician?
Yes.
Okay.
Yes.
Okay.
Yes.
All right.
We see people by referral only. So,
okay.
And a lot of that is just to get the paperwork and the lab results the docs want and things like that, so that your first visit's a meaningful visit. So because we know what your labs are and what everything looks like and that kind of thing.
Right. And you had mentioned that you know, if you were having problems and maybe taking insulin once a day, you should do a stick at least 4 times a day. What time of the day should I do that?
Well,
Recommended.
if you're just on once a day insulin, you may not need 4 times a day. 2 or 3 times may be sufficient, but you definitely want to do morning and before bed. And I would probably change up when I'm doing blood sugar checks in the middle of the day, maybe some before lunch and some before supper. So over time, we get a good picture of what you're doing all day. But if you've got a lot of checks at first thing and last thing, and you vary up what you're doing at lunch and supper, then that gives us a good picture of what you're doing all day. And
the other thing go ahead, I'm sorry.
I was just saying, I know a lot of people get used to going to primary care and they look mostly at A1Cs, but our doctors, they really look at finger pricks. So if you're coming to see us, bring your blood sugar logs with you, because that's, they use those in our practice to adjust medicine. They don't always use those at primary care, but we do. So if you ever come, bring your blood sugar logs.
Gotcha. On the continuous CGMs, what's the average price if you don't have insurance?
It depends on which one. If you have insurance, insurance sets your price. So the insurance would be able to tell you what your price would be.
Right.
If you're going completely without insurance, I know Dexcom's very expensive. I think just the receiver's like $500 or $600. I don't know how monthly supplies are. The lead
Gotcha.
used to be like $150 a month. It was like $75 a sensor, and each sensor lasts 2 weeks.
Woo.
But I've not checked prices in a while.
Gotcha. Okay. Thank you.
Oh, you're welcome.
I have one question for you. I actually have two. Greg Boyd.
Hello.
How do you do? I've never done this before. I'm just starting off with the frickin' thing,
Okay.
and keeping track of it. I heard you say that 75 is a low blood sugar.
70.
What's a high blood sugar? Or 70's low?
Yes. American Diabetes Association defines low is 70 or less. And since your target blood sugar after meals are 80 to 180, technically anything over 180 is high, but 180 is not. So if you have a blood sugar of 180 tonight, don't think you're going to drop dead. That's just information we need so we can better treat you.
Yeah. Well, right now they're only suggesting that I, check it like once a day. Is what I was told. Basically, if I do it in the morning when I get out of bed, and if I'm below, I think she told me 120, then I'm setting pretty good. I don't know. I don't have all the details to it. Well, so at any given point in time, if I'm sticking between 140 and let's say 110, bumping, if I do it in the afternoons or mornings or any, before and after meals, whatever, I'm sitting pretty good then.
It
Correct?
sounds like, well, it depends. If your 140's pre-meal or more than 4 hours after your last meal, that's high. Because if your blood sugar well, let me rephrase that. Your blood sugar is expected to be 80 to 130 pre-meal or more than 4 hours after a meal. So it kind of depends on when that 140 is.
Right. Yeah. Okay. I got you. Okay.
Oftentimes in early treatment, if you're just on a couple of orals or something like that, once a day is all you need to be checking.
Yeah. And that's where I'm at right now. I don't do any shots. I just take, popping pills. Just a pill popper right now.
Okay, well, that's all right. Sometimes that's good.
I'm still banking on the fact that I can get past this and drop the whole thing.
Well, there's no good test to tell us how much insulin you make. So we pretty much go by what your blood sugars are. And sometimes with good lifestyle, you'll always reduce how much medicine you're on. Now, whether you can completely eliminate medication, we'll just see what time brings us.
Gotcha. Thank you.
Okay, you're welcome.
Any additional questions for Carissa? Nope. All right. Well, hearing none, I guess we will conclude for today. Thank you, Carissa, for being our speaker.
Okay, you're very welcome.
This worked out very well.
It did.
And as always, I will attempt to post this presentation either on Facebook or, as Lynn suggested last time, on YouTube. I am checking into that.
Okay.
If I am able to do that, I'll send you all an email about it. Our next meeting will be April 21st, and this will be our grocery store tour.
Awesome.
And this will be in person at the Publix at Lexington Place. And our tour guides for the day will be Kay McKinnis, who is on this chat today, and also Casey Boggs, both from Lexington Medical Center. And we will have that tour started at 11 a.m. to 12:30 p.m. So not an afternoon tour. We're going to be doing it in the morning. And we are limiting it to 10 people. So whenever I send that out, if you want to get on it, you better jump in quickly.
And what date was it? April what?
April 21st.
Thank you.
Yes. Kay, are you still on here?
Yes, ma'am, I am.
Okay, did you want to say anything about the grocery store tour coming up?
No, ma'am, I think you did a great job, but thank you for supporting us. We appreciate it.
Okay, no problem at all. And that email will probably be coming out sometime within the next week or so about the grocery store tour and how to register for that. All right, well, that will conclude us for today. Thank you all for joining.
Thank
Okay,
you.
thank you.
All right, y'all
Bye-bye.
have a good evening.
You too. Bye-bye.